Thyroid cancer. Hey there, welcome to today's video where we're going to be discussing a topic that affects millions of people worldwide: thyroid cancer. Now, I know that the word cancer can be scary, but don't worry. We're going to break down everything you need to know about this condition so that you can be informed and empowered. From the causes and symptoms to the treatment options and prognosis, we've got you covered. So, grab a pen and paper and let's dive in. The thyroid gland is a small butterfly-shaped gland located at the base of the neck, just below the Adam's apple. It produces hormones that regulate the body's metabolism, which affects how the body uses energy. Thyroid cancer occurs when cells in the thyroid gland begin to grow uncontrollably, forming a tumor. There are 4 main types of thyroid cancer: papillary, follicular, medullary, and anaplastic. The most common type is papillary thyroid cancer, which accounts for about 80% of cases. It usually grows slowly and is highly treatable. Follicular thyroid cancer is the second most common type and tends to be a bit more aggressive than papillary thyroid cancer. Medullary thyroid cancer is much rarer and develops from the C cells in the thyroid gland. Anaplastic thyroid cancer is the most aggressive type and is the least common, accounting for less than 2% of all thyroid cancer cases. So, what are the symptoms of thyroid cancer? Well, in the early stages, there may be no symptoms at all. However, as the tumor grows, it can cause a lump or swelling in the neck, difficulty swallowing or breathing, hoarseness or other voice changes, and pain in the neck or throat. If you experience any of these symptoms, it is important to see a doctor as soon as possible. Some of the risk factors for thyroid cancer include being female, being over the age of 40, having a family history of thyroid cancer, having a history of radiation exposure, and having certain genetic conditions such as multiple endocrine neoplasia type 2, MEN 2, or familial medullary thyroid carcinoma, FMTC. If you are diagnosed with thyroid cancer, there are several treatment options available, including surgery, radiation therapy, and chemotherapy. The type of treatment that is best for you will depend on the type and stage of your cancer, as well as your overall health. Surgery is usually the first line of treatment and involves removing the entire thyroid gland or just the part of the gland that contains the tumor. Radiation therapy and chemotherapy may also be used to destroy cancer cells that may have spread beyond the thyroid gland. Managing thyroid cancer can be challenging, but there are things you can do to help yourself feel better. Some tips include eating a healthy diet, staying physical active, getting plenty of rest, and seeking emotional support from friends, family, or a support group. Let me give you 5 additional tips. Risk factors. While we mentioned some of the common risk factors for thyroid cancer in the video, it's worth noting that there are other factors that can increase your risk. These include having a diet low in iodine, having a history of goiter, enlarged thyroid gland, and having a weakened immune system. Screening. Routine screening for thyroid cancer is not recommended for everyone, but it may be recommended for individuals who are at a higher risk of developing the disease. These individuals may include those with a family history of thyroid cancer or certain genetic conditions. Talk to your doctor if you think you may be at risk and ask if screening is right for you. Prognosis. While thyroid cancer is a serious condition, the prognosis is generally good for most people, especially those with early-stage papillary or follicular thyroid cancer. The 5-year survival rate for these types of thyroid cancer is over 90%, and many people go on to live healthy and fulfilling lives after treatment. Side effects of treatment. While treatment for thyroid cancer can be effective, it can also cause side effects such as fatigue, hair loss, weight gain, and changes in appetite. It's important to talk to your doctor about any side effects you may experience and to follow their recommendations for managing them. Support resources. Thyroid cancer can be emotionally and physically challenging, but there are resources available to help you cope. These may include support groups, counseling services, and online communities where you can connect with others who are going through similar experiences. Well, that's all the information we have for you today on thyroid cancer. We hope that this video has helped you to better understand this condition and the steps you can take to manage it. If you have any questions or concerns about your own health, please don't hesitate to speak with your doctor or a qualified medical professional. Remember, early detection and treatment are key when it comes to thyroid cancer, so be sure to stay informed and vigilant. And if you found this video helpful, please give it a thumbs up and share it with your friends and family, and don't forget to subscribe to our YouTube channel for greater videos like this. We'll see you next time with more informative content. Thanks for watching.